This is Group 5's presentation. We will be covering a dialysis program, specifically going over patients with end-stage renal disease receiving dialysis. We will go over a strong assessment and a weak assessment that could be conducted with a patient receiving this treatment. This presentation is by myself, Hannah Burton, Courtney Williams, and Patricia Jefferson. To start out, I will go over a dialysis treatment program. A dialysis program is for patients with an end-stage renal disease diagnosis, also known as ESRD. This means kidney failure. Patients on dialysis treat 3 times a week for an average of 4 hours for each treatment. These treatments are life-sustaining, and patients with ESRD cannot live without dialysis treatment. Social workers complete an initial assessment when the patient starts dialysis after 90 days of beginning treatment. Every year, an annual assessment is completed, and an unstable assessment is completed with each patient if they go into the hospital and then they come back to treatment. Common socioeconomic issues renal social workers experience are no transportation to treatment, and insurance not covering that service, co-pays too high for patients to afford their medications, and no support system at home. Renal social workers also cover kidney transplant for patients. Social workers send the referrals and collaborate with the transplant centers to get the patients on the wait list for a new kidney.
A weak assessment for this situation is the Client Satisfaction Questionnaire 8, also known as a CSQ-8. The pros of this questionnaire are that its internal consistency of the instrument is ranked high, and it allows opinions of patients to be taken into account when devising program improvements. However, its cons include that a low score gives little information about the cause of dissatisfaction. Selection bias could lead to ceiling effects, which indicate satisfaction but not increased satisfaction if improvements were made. The CSQ-8 is not normed for dialysis patients, and questions on the CSQ-8 are only close-ended and do not contain open-ended questions that can elicit more detailed information from the patient about the program and any improvements that can be made.
The comprehensive multidisciplinary patient assessment example social work focus criteria document is intended to be a sample for the community that can be used to satisfy the psychosocial components of the condition of patient assessment found in the condition for coverage for end-stage renal disease facilities, policy section 494.80, which mandates an interdisciplinary assessment of every dialysis patient. These assessment criteria are intended to be used in conjunction with nursing and dietary assessment components, and also identify potential areas for interdisciplinary care planning intervention. The conditions for coverage for end-stage renal disease facility policy section 494.80 patient assessment states the facility's interdisciplinary team consists of, at a minimum, the patient or the patient's designee, a registered nurse, a physician treating the patient, a social worker, and a dietitian. The interdisciplinary team is responsible for providing each patient with an individualized and comprehensive assessment of his or her needs. The comprehensive assessment must be used to develop the patient's treatment plan and expectations for care. The pros of the comprehensive multidisciplinary patient assessment that can be learned from a patient's perspective are: it is individualized, therefore, the psychosocial needs of the patient in end-stage renal disease facilities can be identified and services and resources provided. It specifies the services necessary to address the patient's needs identified in the assessment. It includes measurable and expected patient outcomes to identify improvement and interventions that can achieve identified goals. It includes estimated timetables to achieve outcomes to ensure patients and helping professionals are informed. It contains outcomes consistent with current evidence-based, professionally accepted clinical practice standards. The comprehensive multidisciplinary patient assessment uniformly sets standards of care for dialysis patients. It also provides open communication lines for information exchange among helping professionals who can benefit from the best scientific evidence and guidelines and the experience of others, improving the decision-making process. The cons of utilizing the comprehensive multidisciplinary patient assessment are high time expenditure. The patient may experience a delay in identifying resources and services. There is a risk of treatment delays due to the length of time required to assess the patient's psychosocial needs and the outcome of the psychosocial assessment that may be important to treat the patient from other disciplines who are represented by the interdisciplinary treatment team.
This article's title is the digital Norwegian version of the Client Satisfaction Questionnaire 8, Factor Reliability and Internal Reliability in Outpatient Mental Health Care. The article provides thorough information about the CSQ-8, its reliability in mental health settings, and generalization across cultures.
Social aspects of the 2008 end-stage renal disease conditions for coverage. This article examines the 2008 conditions for coverage for end-stage renal disease facilities to foreground aspects relevant to social workers, such as the comprehensive multidisciplinary patient assessment tool, which can assist in identifying and meeting the psychosocial needs of dialysis patients served. Cruz et al. Achieving Equity in Dialysis Care and Outcomes, the Role of Policies. This article examines the degree to which public policies were enacted to improve healthcare access to dialysis care and how public policies such as end-stage kidney disease may worsen or influence existing inequalities among marginalized persons and highlight a policy solution to practice. Brown and Cruz et al. Are two articles recommended for my classmates because they intersect when we think about policies that extend healthcare access to citizens, undocumented immigrants, and socially marginalized persons. In Cruz et al. Article, the authors assert that socially marginalized persons, racial and ethnic minorities, people experiencing homelessness, groups with low incomes, and non-U.S. citizens disproportionately experience end-stage kidney disease. The authors cite factors including inequalities and timely referral to nephrology for the start of dialysis treatment, placement on transplant lists, and receiving a kidney transplant. In states where Medicaid is not expanded, there is a high incidence of pre-dialysis care among Black patients. Federal policies such as the Affordable Care Act prohibits undocumented immigrants from purchasing federal health care insurance. However, it prohibits discrimination based on pre-existing conditions so undocumented immigrants become eligible to buy insurance. The authors assert that the Advancing American Kidney Healthcare Health Executive Order's goal is to reduce the risks associated with kidney failure, improve access to quality treatment, and increase access to kidney transplants. Brown and Cruz et al. Articles speak to the power of policy to change practices so that the dignity and worth of all dialysis patients are valued. The Social Work Code of Ethics is rooted in human rights, and that social workers respect the value and dignity of individuals and groups in the context of the human experience.
Thanks for watching our presentation, and we hope that you have a better understanding of the dialysis program after watching this. Please feel free to reach out to us via Canvas with any questions that you might have. Thanks.